COVID cases steadily rising. If we take a cursory look at how these COVID cases are rising, and I did some computation on our 7 days daily, an average of our 7 days daily positives. Between the week of 17th to 23rd of May, we were reporting about 52 cases on average per day. 24th to 30th May, 99 cases per day. 31st to 6th June, 102 cases a day. 7th to 13th June, 122. 14th to 20th June, 146. 21st to 27th June, 190 cases a day. And this last week, 28th of June to 4th of July, we had 261 cases. So that is ample proof that our cases are rising and the curve is beginning to become steep. These rising cases of infection imply that many more people will require critical care and our healthcare facilities risk being overwhelmed. Correspondingly, our fatality rate is also likely to increase. Under the current circumstances, our case fatality rate is 2.09. While this may be within the recommended global standard, it should remain of great concern to us because no life should be lost under any circumstance. As government, our focus has been to upgrade our healthcare systems across the country in order to provide quality services to our people. And at this particular time also, in order to ramp up our level of preparedness to deal with this COVID surge when it comes. It must, however, be understood that the first line of protection against corona is not at the hospital. Protecting one seeking medical attention only comes after infection. Protecting one from being infected is the most effective way of curtailing the spread of the virus. The protective measures the ministry has been advocating are by now well known to all of us and include hand washing, wearing of face mask, keeping social and physical distance, and avoiding gatherings, among others. The importance of the measures is that they are not only useful, but easily doable by everyone. Nonetheless, the growing number of positive cases indicates that the containment measures are not fully adhered to. We have observed that many of our people are going about their everyday activities as if we are in normal times. There have been cases of illegal gatherings, such as house parties in various counties, with people paying no regard to the need for social distance or wearing of face masks. Operators in the transport sector have gone back to the old ways of doing business. We are currently witnessing overloaded vehicles, particularly in rural settings, with border operators carrying more than one passenger. These are practices that require personal responsibility by all of us. The expectation to have an enforcement officer to police every person is not possible. We must therefore rise up to the occasion and be responsible citizens, failure to which this disease will spread even deeper within our society and leave a trail of destruction. Ladies and gentlemen, moving on now to our COVID statistics of the day. We tested 4,228 samples over the past 24 hours. These samples came from 37 counties. The top 10 counties accounting for these 4,228 samples are Nairobi with 43.7% of the samples, Mombasa with 12.2%, Narok 6.5%, Busia 5% of those samples, Nandi 4.8%, Nakuru 3.8%, Kajiado 3%, Kisumu 2.9%, and Turkana 2.3%, and Makueni 2.2%. So this is where the majority of the samples, 86.4%, came from these 10 counties. The other 27 counties collectively accounted for the balance of 13.6% of the samples. Of the 428 samples tested, 309 were positive. The total caseload in the country is now 7,886. And the total number of samples that we have tested so far is 189,263. With the exception of 7 non-Kenyans, the rest of the positive cases are Kenyans. 217 of these cases are males, 92 are females. The youngest is a 1-year-old infant. The oldest is 83 years old. The distribution of cases by counties is as follows, again according to the number of positives detected in each of these counties. Nairobi with the largest number of 193 positives, Kajiado 22, Kiambu 20, Mombasa 18, Makueni 17, Busia 11, Machakos 9, Nakuru 8, Nandi 3, Turkana 3, Narok 2, Nyandarua 1, Kakamega 1, and Kilifi 1. If we go below the county level and look at the sub-counties, in Nairobi, the 193 cases are from Langata 56, Kibra 18, Westlands 15, Dagoretti North 13, Kasarani 13, Ruaka 12, Embakasi East 11, Embakasi West 11, Makadara 10, Starehe 10, Embakasi South 6, Kamkunji 6, Roysambu 5, Embakasi Central 4, Dagoretti South 1, Embakasi North 1, and Mathare 1. In Kajiado, the cases are in Kajiado East 13, Kajiado North 6, Kajiado Central 3. In Kiambu, the cases are 20 cases come from Ruiru 9, Kabete 5, Kiambaa 2, Kikuyu 2, and Kiambu 1, and Thika Town 1. Mombasa's 18 cases are from Vita 8, Jomvu 6, Changamwe 2, Likoni 1, and Nyali 1. In Makueni, all 17 cases are from Makueni West. In Busia, the cases are in Teso North 6, Teso South 5. In Machakos, all 9 cases are in Athi River. While in Nakuru, 8 cases are in Naivasha 3, Gilgil 2, Nakuru East 2, and Nakuru West 1. In Nandi, the cases are in Mgwen 2 and Nandi Hills 1. In Turkana, all 3 cases are in Turkana West. In Narok, the cases are in Narok East and Narok North, 1 case each. In Kilifi, the 1 case is in Malindi. In Nyandarua, 1 case is in Olkalau. And in Kakamega, the 1 case is in Lugari. We are also glad to inform you that 51 patients have been discharged from the various hospitals where they were receiving care, bringing the total number of recoveries to 2,287. Once again, we want to appreciate our healthcare workers who have been working tirelessly and selflessly to make this achievement possible. It's unfortunate that we have also lost one patient to the disease, bringing to 160 the total number of deaths in the country. Our heartfelt condolences go to the family and friends who have lost the loved one. In conclusion, I want to remind our people that it is of utmost importance that we observe the containment measures. There is no silver bullet against this virus other than adhering to these measures. Any laxity can spell disaster for us in the coming days. Thank you.
Thank you very much.